Hello, this is a virtual pathology specimen showing the heart, and we are looking at the left ventricle into the left ventricle where it has been cut open. So this is part of the free wall of the left ventricle, and it continues over here. What we're looking at here is the mitral valve with the papillary muscles here, and this is the aortic valve with the proximal part of the ascending aorta. Posteriorly, we have part of the left atrium and we have the right ventricle, and you can see the wall is much thinner than the left ventricle. This left ventricle is very abnormal, and this is an example of acute myocardial infarction with mural thrombus formation. Let's have a quick look at the labels. So here we have the left ventricular wall. This pale area of discoloration that continues all the way here is part of the myocardial infarction. And this craggy brownish area is actually a mural thrombus that is adherent to the myocardium. Let's take a more magnified look. Here is the area of abnormal myocardium. We can see the normal viable muscle, and this very pale area with a bit of a hyperemic darkened rim. This is the area of infarction. It is very extensive and extends pretty much almost to the full thickness of the myocardium. And this brownish area here is the mural thrombus. Let's take a look at some of the complications of myocardial infarction. There are many complications that can occur at different times, some more acutely and some in the recovery phase or even months or years later. There may be contractile dysfunction because of necrosis of the muscle and therefore the pump is affected, and this can give rise to left or right ventricular failure depending on which part of the heart is involved with the infarction. There can of course also be myocardial rupture, and the consequences really depend on where the rupture is. For example, if it's in the free wall, there may be hemopericardium with rupture and blood filling up the pericardial sac and therefore leading to cardiac tamponade. If the rupture occurs in the interventricular septum, for example, as you can see here, there is a defect. This can lead to left to right shunting. And this case that we are looking at now is mural thrombus formation. This is due to stasis, sometimes dilatation of the left ventricle, and also endocardial damage. Therefore, all these factors predispose to thrombus formation. And of course, one of the most important and dangerous downstream effects is thromboembolism, and this will go to the systemic circulation. Ventricular aneurysm can also occur because of loss of viable muscle and therefore leading to weakening and outpouching of the ventricle. And here we can see not only ventricular aneurysm but also a mural thrombus forming in the aneurysmal pouch. This can also give rise to arrhythmias and heart failure and also potentially rupture. In addition, the papillary muscles that we saw here earlier, these can also rupture, or they can eventually undergo scarring and shortening, giving rise to mitral valve regurgitation. And there is also a potential for pericarditis, in particular fibrinous pericarditis, which is an inflammatory response to the dead muscle. And here is an example of pericarditis. This usually occurs within a few days of the myocardial infarction. This is the homepage of our cardiovascular system chapter in our virtual pathology museum, and this is part of Pathweb, our online pathology learning resource. You can register for full access to our museum using the link in the video description. As we scroll down, you will see that there are many thumbnails, and each one of these will take you to a page describing that particular condition and also showing the virtual pathology specimen. Here are 3 examples of the complications of myocardial infarction that we have just looked at. And this is the example of pericarditis. There are also accompanying videos similar to this on each of these pages. Let's summarize the case that we are currently looking at. And therefore, in summary, this is an example of extensive myocardial infarction involving the left ventricle that is complicated by mural thrombosis. This mural thrombus has a further complication of thromboembolism. Thank you.